get started and call this October meeting of the El Paso County Board of Health to order. Sorry for the delayed start this morning. Start off by going around and doing a board member roll call. Start with Doris Ralston
Present.
and Cammie Bremer.
Present.
Glant Havener.
Present.
Dave Donaldson.
Here.
Dr. Deborah Chan.
I'm here.
Lujinos Gonzalez.
Here.
And not here yet is Dr. Richard Vu. He has texted me this morning and said that he would be about 30 minutes late, so he will be, I'm sure, walking in just a few minutes. Hopefully everybody's had an opportunity to look over the agenda, and we'll need a motion and a second to pass the agenda.
Doris Ralston, so moved.
Thank you, Doris. Do we have a second?
I'll second.
Thank you, Mayor Havener. All in favor of passing the agenda, let it be known by saying aye.
Aye.
Aye. Any opposed? And there is none. Now we're going to open it up to board member comments, and I'll kind of go in the same order with Doris going first.
I'd just like to commend the staff and the leadership team here at El Paso Public Health and for all the great work that you do. I know it's not easy, but we really appreciate all that you do for the health of our community, so thank you.
Thank you, Doris. Commissioner Bremer.
I don't have any comments, thank you.
And Mayor Havener? Councilman Donaldson?
No comments.
Dr. Chan?
Yes, I do have a comment. I'd like to thank everybody for forwarding the information addressing some of the questions that were raised during last month's discussion. The memo was very informative and very interesting. That memo, though, did bring up a significant concern, I think, and that is the memo seemed to indicate that the rate of overdose deaths is twice as high in men as it is in females in our community. And that combined with the information that was shared at the last meeting as well as the meeting before regarding suicide deaths, accounting with men accounting for 75% of the suicide deaths, and then the overdose deaths being unintentional, not suicide. Added on top of that, those are only 2 points that affect specifically the men way out of proportion. And I'm very, very concerned that that there may be insufficient funding as well as programs to specifically address men's health in our community. And I would really like to encourage some consideration of seeking funding sources and programs which might help to bring down the disproportionate number of health issues that affect men, not only with suicide and drug overdoses, but as we know during COVID, men's deaths were much out of proportion, and then in other non-infectious diseases such as cardiovascular health, it continues to be true. And I also would like to maybe consider staffing within public health. There has been a turn in the last few years towards females being in the field much more than men. And I definitely would not want to have anything that discourages men from participating in public health, as well as programs that address men's health, as well as outreach, which may help to address these concerns.
Thank you very much. And Commissioner Gonzalez.
Thank you. I thought maybe we should get an update. I think we did have something, I want to say marketing, but some targeted efforts in the last 2 years towards men that I thought the Board of Health or Public Health was doing. So that would have started before you're coming on. So maybe if we can get maybe an emailed update of stuff we had presented in the past, but it's probably been since early this year, or middle of last year, that we got an update on that. That might be a good idea to support you. The other one was, I did want to mention, last month, the board voted to approve the opposition to the local recreational marijuana votes. One supporting a ban by the city and the one opposing the allowance of recreational marijuana. I just want to highlight the county commissioners also passed a similar opposition to the recreational marijuana sales. Thank you.
Thank you. Okay, I guess, public comment is just to congratulate Commissioner Bremer. Well, I think we're all aware that she has gained a new position within our community, a very high-profile position in an organization that reaches really all of our community members. And we're very grateful that she's going to fill that spot. Maybe, my fingers are crossed that she could maybe fill the spot of the vacant nonprofit position on our board here. I don't know how that might work out, but speaking personally with your history with this organization, we would love to see you stay on. But congratulations, and you're going to do fantastic work for the United Way. They're very lucky to have you.
Thank you.
Okay, moving on now, we need the vote for the approval of minutes. So I'll need a motion and a second.
Lohino, so moved.
Thank you, Commissioner,
Deborah Chan, second.
and thank you, Dr. Chan, for the second. All in favor of approving the minutes as they are written, let it be known by saying aye.
Aye.
Aye. Any opposed? There are none. Do we have any public comments? No? Seeing no public comments, then we will move on to item 6 on our agenda. We have a resolution regarding the decrease in public health capital assets threshold. And Susan, do you want to explain that a little bit, or, I'm sorry, I see somebody else. Okay.
She's the financial manager of the county.
Hi, I'm Debbie Korean, I'm finance manager for El Paso County. Today, we have a proposal for you to decrease the capital asset threshold for public health from 25,000 to 5,000. There's out there what's called OMB circulars that provide guidance for all agencies that accept federal funds. And the guidance that has been published recently has suggested that that the current guidance has been $5,000 for basically any federal funds that are used to purchase capital assets. The capital assets are tracked at $5,000. And they're proposing that limit be increased from 5,000 to 10,000. Now, for a long time, many, many years, public health has had a threshold of 25,000. And what that means is my accountants have had to separately track capital assets that were purchased with federal funds separately from your capital asset threshold. And they have done that, but we would like to get in line with the new OMB guidance and get in line with where El Paso County is at. So El Paso County currently has a threshold of 5,000. We will be proposing to the El Paso County Commissioner soon that our threshold is increased to 10,000 to align with the OMB guidance. And we'd like to have public health be the same. That way, we don't have any risk of missing a capital asset, because if we keep your threshold at 25,000 and you purchase a capital asset that is between 10,000 and 25,000 and we miss that, there's some risk for us. And we want to reduce that risk and just have it uniform with the county and with the guidance that the federal government is putting out for us. So we'd like this proposal to be effective January 1st, 2025. It's hard to make a change mid-year. For accounting purposes, it's much easier to. So we're proposing that change is effective January 1st, 2025. So any questions?
Questions from the board?
So is the request for 5,000 or 10,000? You said
10,000, sorry, I'm
Okay.
sorry for the confusion. The county currently is at 5,000, and OMB guidance until October 1st has been at 5,000. And they're proposing we increase to 10. So
Okay, so-
I'm proposing you go from 25 Public Health 25 to 10.
Effective January 1.
Yes, correct.
Okay.
Correct.
Any other questions? Okay, thank you very
Thank you.
much. I guess we're going to need a vote on that. So I'll need a motion and a second.
So moved, Dave Donaldson.
Okay, thank you, Commissioner Donaldson and Mayor Havener. All in favor of passing this resolution, let it be known by saying aye.
Aye.
Aye. Any opposed? And there is none. Okay, moving on to finance and budget. And this is probably going to take the majority of our meeting this morning. We'll have the September budget first, and then we'll get into the preliminary budget for 2025.
So, first of all, my name's Taylor Hartshorn. I am a budget analyst with El Paso County Financial Services. I've been with the county for around 2 years and been with Public Health the entirety of that time. So, September managerials, these are, as of the end of September, our El Paso County and state funding is coming in exactly in line, right where we expect it to be. So all of that looks good. Program-specific grants are coming in a little bit under where we would normally expect them to be. That is mainly a result of timing in those reimbursable grants. We will continue to watch that as the year goes on to make sure that we are executing on those grants fully and bringing in that revenue throughout the year. Medicaid fees and insurance, we are a little bit ahead of trend, and that's due mainly to an increased focus on billing and clinical services. And so that's positive news there. And interest income, contributions, donations, we see pretty much flat there, right where we expect them to be. I don't have any concerns revenue-wise. As far as expenditures go, we're continuing to track vacancy savings. We do see a sort of a pot of vacancy savings there that we're following throughout the year. We don't expect it to be that full 1.6 million, as there are some one-time expenses throughout the end of the year, but that again is something that we're tracking closely to make sure that everything falls in line at the end of the year, and we're tracking towards that budgeted net impact number for the end of the year. Operating's down just a little bit, which falls in line with the program-specific grants, as we're not bringing that revenue in for program-specific grants due to timing. We are not spending that money as well in operating. So those kind of go hand in hand, and we see that here. Capital, there are no more expenditures for the year, so that has maintained and been in the same month over month. So overall, I don't have any concerns, but just important to note that we are monitoring both revenue and expenditures to make sure that we're coming in on budget for the year. And I believe that's all I have for the financial services, or for the monthly report here.
Questions from anyone on the board? Okay, well, thank you for that September report. And I think you're going to stick with us, right, Taylor? For
I am. I will be here for a little bit. Sorry, let me get my bearings here and make sure I know how to work. I don't have anything.
You need to point it at the laptop, wherever the second part of that is.
Okay, perfect. So today we're going to be looking at the 2025 preliminary balanced budget. Again, I'm Taylor. We have worked diligently with Public Health on this, and we're going to run through this and basically, to start, just give you an idea of what we're going to go through this morning. First, we'll have a historical budget review. We'll look at the past few years of public health, as well as a review of the fund balance. Then we'll run through the budget process from start to finish and how we've gotten to this point today. And then we'll take a look at the 2025 preliminary balanced budget as it stands. What we're looking at here is a historical review of total revenue back to 2013, mapped alongside the El Paso County population. As you know, the El Paso County population is growing. What's important to note here is as COVID funds continue to wind down, and they have we have expended all of COVID funds moving into 2025. The green line, the top green line, meets with the bottom line there to show that our total revenue is now back to a base budget. Those COVID funds have been all expended, and we're budgeting 2025 without any COVID funds. So we do see that slight decrease in revenue from 2024 to 2025. This here is another representation of expenditures and revenues over time. As you can see, expenditures and revenues have moved in line with each other. It's a pretty straightforward picture we're painting here that as our expenditures have increased, revenue has gone along with them. We do see that big jump in revenue starting in 2020 and expenditures during the COVID years, and that's something we'll talk about as we move forward. Here we have a chart of the full-time equivalent public health employees through the years. The FTE count has increased drastically during the COVID years. We see starting in 2021, we go from 158 to 180, all the way to 228, and then we start that decline as that COVID funding continues to draw down. It's important to note that public health has been very intentional about evaluating positions as they vacate, as they become open, and decreasing that FTE count to continue to right-size with revenue as that revenue falls with the expending of COVID funds and the ending of all of that, the COVID grants. And they're doing that very strategically and trying to maintain the efficiency and providing quality services while continuing to right-size that organization size. As you can see, there's a small note here that the national average for public health agencies of El Paso County size, which is between 500,000 and just under 1 million employees, is 309. For 2025, we're proposing around 195 FTEs, so well under that national average. And I'll come back to that a couple of times when we move through some of the other portions of this budget. So now we're going to get into the fund balance. El Paso County Public Health has a fund balance policy that is 18 to 21% of revenues. The fund balance is essentially your operational reserves. It's cumulative revenue over expenditures or any assets or liabilities. So we do have a fund balance policy of 18 to 21%, like I said, that was adopted in 2016. This fund balance policy is conservative even in comparison to the current Government Finance Officers Association recommendation of 16.7. So we are conservative even in comparison to the GFOA recommendation, and that is in line with the county as well. As of the end of 2023, this is where we sit with the fund balance. The total fund balance is 8.23 million, just under it. There is 364,000 of TABOR restricted per state statute that we must keep as part of our fund balance. And then we have a little bit of non-spendable fund balance as well. The unassigned fund balance, which is the 7.75 million, as of the end of 2023, is about 30.1% of actual collected revenue, which is again well above that 21% minimum fund balance that we have. So we're in a good spot fund balance wise. This is showing the fund balance over time. So we see here the fund balance really jumped up during COVID with the influx of COVID funding and the continued county and state support. That, coupled with some vacancy savings and some open positions, allowed that fund balance to grow to grow to a healthy level. The green ribbon that you're seeing here, the sort of wave, is the 18 to 21%. So that represents the fund balance policy. In short, this graph is showing that we do have a healthy, robust fund balance, and it's continued to grow, and throughout, as we wind down from COVID, we see that fund balance start to decrease as we had large increases during COVID.
Can I ask a quick question?
Sure.
So the unassigned fund balance, there's what we're seeing on this graph is a representation of that 30% overage, essentially?
Yes, essentially.
What is standard in reserves or in a fund balance?
So In general, the fund balance should, we should have at least 2 months of operational expenditures in there. The 18 to 21% is a conservative estimate for that, and so ideally, we would keep that fund balance at a healthy level around 18 to 21% to make sure that it's available for any emergency response that's needed or any one-time expenses that may come up throughout the year.
Okay, thank you.
So now we're going to get into the process, the budget process, the calendar, the sort of the whole, how we've gotten to this point. This chart shows that, this shows the county budget as well as the public health budget. The colors there in red or orange are the public health dates. So the county budget had some preliminary hearings in October. There was critical needs presentations October 15th and 22nd for the El Paso County budget. October 23rd is today. I'm standing here for the 2025 preliminary balanced budget. November 5th, there will be Board of County Commissioner direction on the El Paso County budget. And then December 12th, 10th or 12th, the El Paso County budget will present their final original adopted budget. December 11th, I will be back here to present the El Paso County Public Health 2025 final original adopted budget. Here we're going to run through the budget process. We have had a pretty robust budget process here to get to today. We had preliminary planning starting in June and July with Public Health Director, executive team, and leadership as we started the very beginning of moving through this process. October and December, we had thorough reviews of staffing, of FTE positions, and budgetary discussion with program managers, looking forward to any needs or concerns they had moving into 2025. The thorough review of staffing included looking at all FTE positions, looking at vacant positions, making sure that we were continuing to be efficient with those positions given limited funding and staffing. Then we moved to September, where budget was compiled, and we held division-level budget meetings with each division and program managers in those divisions, where we went through their budgets with them to make sure we were all on the same page, that everybody had an understanding of their budgets and what we were looking for moving forward, any requests that they had, any concerns, again. And then a preliminary review with leadership also was undertaken in September. This month, October, we've had ongoing review with public health leadership, executive team meetings to make sure we have everything nailed down, make sure we've got everything in the budget that should be. And we reviewed any additional funding requests that came from programs with public health leadership as well. The preliminary balanced budget that you'll see today was prepared by budget staff with consultation with the public health director and that leadership as well. And then that brings us to today, where we have a presentation to the Board of Health of this preliminary balanced budget. Just a little more on the budget process on our end. We start by evaluating revenue, making sure that we have a program-by-program understanding of all of their grants, what those revenues are going to be for 2025, and making sure we have all of that information into the budget so we can get an accurate revenue number to work from moving forward. Then we do a complete review of staffing, as I just mentioned, with personnel. Public health and budget does a complete review of staffing, looks at all those positions, makes sure that we have them allocated to the right cost centers so they're distributed the way, so that they're distributed to the right programs as we move forward. Then we take a deep look at operating expenditure evaluation and analysis. So we remove any one-time prior cost or one-time cost from the prior year. That would be, in our case this year, capital was one of those costs that was removed from last year's 2024. That was a one-time expense. And then we do a computation of any indirect cost by program, which is an indirect rate that is negotiated with the state, or sometimes it could be with the federal government. The indirect rate varies program by program. We make sure we have those right indirect rates and that they're all put in correctly to support administrative functions and public health. And finally, we remove any grant funding that may be ending in 2024 and 2025. American Rescue Plan Act dollars did end or will end in 2024. So that was a big one this year that we had to make sure we were accounting for and budgeting correctly for in 2025. And in 2025, we also had to make sure that any grants ending in 2025, we were accounting for and budgeting for correctly.
Excuse the interruption, just for the record, Dr. Vu has joined us.
So now I want to get into some budget process highlights, but before I do, I want to thank all of the program managers, division directors, everyone at Public Health that has worked very hard on this budget. It was a very all-hands-on-deck effort from them to get this budget to a place that it is today. And I just want to thank them for their effort and time in preparing this budget. It's been very helpful for us on the budget staff to be able to work with them in that way. So we'll get into some highlights here. Some of the highlights of the 2025 budget. We've enhanced professional development and continued resilient support for staff. I think that was very important coming from a public health leadership. We evaluated staffing and organizational structure to match public health priorities for optimum efficiency. Again, that's been a very key point in developing this budget, was making sure we had our staffing in the correct places and all of those positions were efficient to execute what public health's programmatic needs are. We have an increased access to services, and we've prepared to respond rapidly to any emergent public health needs as they arise in 2025. This here shows the state and core support through the years, state and county support. The important thing to see on this graph, one is that, again, population is rising, but the bottom line is the state local public health agency funding. Through COVID, that funding was increasing in response to the pandemic, and it began to decrease at the end of, in the middle of 2024, there was a provision that expired, but you can see an increase between 2024 and 2025. Public health has received an increase in state local public health agency funding as a result of advocacy and working with the state to increase that number. So we did see about a $316,000 increase. And that was a resolution that came before the board in June of this year to recognize that increase in revenue, and that revenue increase will continue in 2025. So that is one of the main takeaways from what we're looking at here, is that we did receive an increase in state local public health agency funding due to advocacy from public health leadership and their team. Now we can look at a couple of budgetary challenges that we have. Some of these are ongoing. As we see year over year, El Paso County population has increased since 2008 from just under 600,000 to just under 770,000. It's a 28.5% increase over those 17 years. That is quite a large increase, and as I mentioned earlier, health departments of our size have about 309 full-time equivalents, and El Paso County in this proposed budget has 195. So we do have a growing population and a continued need for staffing. With this growing population, an increase in demand for public health services accompanies that. So that is a budgetary challenge that we continue to have to meet with limited staffing and funding, and that's something that we've tried to work through in these budgets. And a need to respond to that increased population goes along with that. The last thing on this, the majority of public health funding is from grants and contracts, which are restrictive and time limited. So they're restrictive in scope and they're time limited. Sometimes they're very time limited. So that is a budgetary challenge that we have, that some of the money, some of the allocated funding is very restrictive in how we can spend it. So that's something we have to keep in mind as we move through this budget. Now I'd like to talk about some agency successes. Like I mentioned a second ago, the increase in state funding, that was a big success for the agency. They advocated and supported legislation to increase that state funding for core public health services. That is very flexible funding that opens up a little bit more ability for the budget. They had a great execution rate with state grants, about 96%. They've secured grant funding to meet specific time-limited issues, and they are eligible to compete as a direct recipient for Centers for Disease Control and Prevention grants due to El Paso County's population size now. So that opens them up to some more opportunities for direct funding. And lastly, they have partnered with the El Paso County Sheriff's Office to make public health nurses available at the Criminal Justice Center. And one more note on that, El Paso County Public Health, we're gonna continue to plan to increase cost recovery over the next 3 years to meet the expectations of the community and continue to provide quality services while aligning the revenue with the base budget. So there is a 3-year cost recovery plan to continue to pull this budget in line with the base budget. Pull the revenue in line with the base budget, I'm sorry. Now we're going to get into a little bit of revenue overview. Again, I want to give thanks to El Paso County Board of Commissioners and the El Paso County Board of Health for their continued support of El Paso County Public Health. Now, a little bit of downside here. We did have some decreased revenue due to COVID-19 grants ending in 2023 and 2024 on the revenue side of things. But again, positive effect of increased state, local public health agency funding offset that a little bit. We do have revenue from multi-year Centers for Disease Control and Prevention grants to support staff. That is a very large multi-year ongoing grant that we are continuing to execute on. And there was a assessing and evaluating fees agency-wide to provide accurate budget estimates moving forward. Expenditure estimates, there is an investment in human capital. There's been minor changes to program personnel due to current program funding, some shifting into different cost centers as grants evolve. And then we have built in an estimate increase to employee compensation and benefits. At this time, I don't have the details, but what I can say is that El Paso County Public Health will follow the methodology of El Paso County. So when El Paso County has final approval on that, El Paso County Board of Health or El Paso County Public Health will follow that direction. And personnel costs this year represent about 78% of the total budget. That's up 2% from last year. Last year, personnel costs were around 76% of public health's total budget. So here we're going to look at the preliminary balanced budget summary. This is the 2025 preliminary balanced budget. Total revenues come in just under around $27.3 million. Total expenses are $28.2 million, and that brings us to a proposed fund balance use of $888,414. And I will get into some differences between 25 and 24 on a later slide, but this is the nuts and bolts of the 2025 preliminary balanced budget.
Go ahead.
Quick question. And the state LPHA funding is based on population, and so across the board, other health departments in the state are seeing the same. Is everybody equal on that?
The funding formula consists of a population. However, there are different components of that funding formula. There are, all of the counties have received an increase, and El Paso County, since we have the greatest population, then we do well with the funding. I did want to note that before the pandemic in 2019, our state funding was a little over $900,000, so it was under $1 million. And so ongoing, the increase in state funding that occurred during the pandemic has been approved to receive every single year. So that is good news for El Paso County Public Health as it relates to the ability to fund core services for the community.
Thank you.
Dr. Vu.
Can you remind me what ELC is?
ELC is epidemiology laboratory capabilities. So there was that's one of the program-specific time essential grants that we did receive in 2024 and moving into 2025 as well to respond to some of those needs.
What is the clinical revenue come in these? Which line item would that be?
Some of the clinical revenue would be in the licenses, fees, and permits, but I would have to circle back for a more detailed answer on that.
Thank you.
Okay, so in short, proposed net use of fund balance is $888,414. What will make that up in a brief high level here is some American with Disabilities Act's digital compliance technology that is needed to comply with new legislation and new regulation. Public health response and recovery. So public health has a responsibility to be able to respond to emergencies or emergent contingencies rapidly if needed. In that case, if and when public health response and recovery funding is used, timely and accurate reporting will be presented to the board on that response. And then retail food establishments. This one I want to talk about briefly. The Board of Health support for environmental health services fees has been extremely helpful. However, retail food establishment fees are not part of those increases that we had last year. They're set at the state. They're for things like restaurants, food trucks, cafeterias, gas stations, drugstores. Those are set at the state on a triennial basis. Public Health is currently working diligently through the triennial review process with the state to increase those fees. But the proposed use of fund balance will help bridge that gap of funding as they work with the state to increase that revenue source.
And Taylor, remind us, when was the last time that those fees were increased?
I do not know that off the top of my head, but
2016, but they're supposed to be on a 3-year. Okay.
yeah, so they're reviewed every 3 years.
Yeah, so I can add a little context. We also have Jeff Lawrence from the state online with us who can add a little bit of additional context too. The triennial review process is not specific to fees. What it does is it establishes a stakeholder group every 3 years to identify concerns relative to the retail food program, fees being one of those. Fees was identified as the concern in 2015, effective in 2016 is my understanding. They've done this process every 3 years. Under COVID, the stakeholder group did not identify a concern at that point that they wanted to pursue, which is why the fees have been extended until this point. So the fees is a concern that they want to pursue at this point, which is where that's coming into play.
Perfect.
Jeff, if you're available, did I speak to that correctly for clarification?
Yes, Kat, you nailed it. Nice job.
Perfect. Okay.
Okay, just wanted to make that distinction between what the board approved last year and the retail food establishment use of fund balance this year. This is a deeper look at the fund balance. Fund balance is essentially operational reserves that we have, and the vast majority of fund balance in our case is from vacancy savings. So the increase in COVID funding through 2021 and 2022 and 2020 allowed for a healthy fund balance to continue. So the state and core funding was still there. You couple that with recruiting and staffing challenges that we had, the vacancy savings built up a very healthy, strong fund balance. It's important to point out that even through the use of fund balance in 2023, we have a budgeted use of fund balance in 2024 and a proposed use of fund balance in 2025. Even with the use of that fund balance, we are well above the gray line, which is our 21% of revenue. That is the minimum fund balance policy. So that's important to note that even with these 3 years of use of fund balance, we still are in a very healthy, robust fund balance environment.
Commissioner.
Thank you. If I can add some context here, and Doris was around during this time. Dr. Turbush was a strong advocate, as was Commissioner Littleton at the time, that we should not just be right at that 21% recommendation, but similar to like the county commissioners had added in kind of emergency reserves. It was like, well, what happened, the what if scenario, breakouts, this COVID. And so this is, the timing was amazing because that 2020, that was recommended in 2019. And so you see that big increase. The increase was based on the Board of Health, especially Dr. Turbush saying, maybe we should get $1 million of excess, in case something happens. And look what happened. A year later, we're in a pandemic where we were in such strong shape. So when we say $1.5 million, $2 million over, any use coming down in these last several years is a good, smart, and appropriate use of those reserves, because we still remain about $1 million above what the recommendation is. And so if the public sees that, we're going into the budgeted, or the reserves there for the last couple of years. This was kind of like what the plan was, and we're still even above the 1 million excess that others had thought about several years ago. But amazing, Board of Health decision, Dr. Turbush, a strong leader, asking for $1 million literally, months before accidentally, before the pandemic, and we were in strong shape.
Thank you.
Okay, yeah, I think that's wonderful to note that we are still, the fund balance is being handled well and is in a good spot moving forward. So here are the changes from the 2024 revised final budget to the current 2025 preliminary balance budget. We do see the decrease where we see the American Rescue Plan Act decrease is in El Paso County funding. That was a pass-through from the county, so we do see the decrease there. We see an increase in state LPHA funding, as we've talked about. And overall, revenues are sitting just a little bit down from last year, not a whole lot of change. And the same can be said with expenditures. We see a slight decrease in operating expenditures, and total operating expenditures are almost flat, just down about $50,000. I do want to point out the personnel expense. Public Health, as I said, has been intentional about decreasing that FTE count moving forward to right size to revenue. Even with the decreases that they've made over the last 2 years, the increase in benefits cost and compensation has accounted for an increase of about $500,000 going from 2024 to 2025. So while they have been diligent, we do see those increased costs hitting our budget in 2025 and 2024 as well. And again, the net fund balance there, you see $888,414. And these last two slides, we're just
Taylor?
Yes.
On this past slide, can you explain the large difference in the ELC from last year to this year?
Yes. So the new grant amount in 2025 is a different grant amount than the previous grant. So it is essentially it's a decrease as they wind that program down. El Paso County was successful in going after the new ELC dollars. It was not something we were guaranteed to get. It wasn't something that even in 2024 that we were planning on receiving. So it is a new grant. It just falls under the same emergent or epidemiology laboratory and capabilities funding. So it's a new grant separate from the 2024 amount.
Right. Is the difference or the decrease, is that at all tied to COVID funding going away?
I can't speak 100% on that right now, but it is, those are related to COVID dollars. Those, they've sort of shifted the scope on that grant a little bit, but I'll let Dan, yeah.
Thank you, Taylor. Deanne Ryberg, Deputy Director. The ELC funding originally was part of the funding to support the COVID response. Moving forward, we were not anticipating that grant to continue. However, in preparation for respiratory diseases more broadly and to build public health capacity, there was this final ELC offering from the state known as ELC 2.2 with a changed scope of work that has, instead of a COVID-specific focus, a broader focus on respiratory diseases and public health data infrastructure that is anticipated to end mid-year in 2025. So this is the remaining portion you see reflected in that 2025 budget that will take us through the first half of 2025. And then we anticipate that that funding will go away.
Thank you.
Ask a question.
Sure.
I'm sorry, I think I missed your point regarding the personnel expense. Am I to understand that for 2025, there are 2 fewer FTEs than 2024, but because of other increases in personnel expenditure, the personnel expense budget is actually a little bit higher? Is that correct?
Yeah, we are budgeting for an increase in benefits cost, as well as following the county's direction on employee compensation increases. So that we do see a slight increase in total personnel cost, even though that FTE count is dropping a little bit.
Okay, and then I have another question about the interest income. Is that interest income primarily from the, what do you call it? The fund balance? Yes.
Yes, that interest income is driven from the fund balance.
Okay, so isn't the fund balance for 2025 projected to be smaller than the fund balance for 2024, also in an environment of falling interest rates?
Yes, so I will briefly speak to this. I don't want to get too deep in the weeds here, but the estimate we had for 2024 was very conservative. The actuals we are seeing in 2024 on that interest income is actually higher than what we budgeted. So since we're seeing that higher interest income, we've budgeted just a little higher to be in line with where we think that projection should be. So we were conservative in 24, and we are continuing to be conservative in 25, but we were just a little too conservative in 24.
Thank you.
Okay, so the last two slides are just a breakdown of revenue and expenditures. Like I mentioned before, program-specific grants and contracts make up just about 50% of total revenue. El Paso County funding is just above a quarter, 25%, and license fees and permits across the agency are around 16% of the total revenue for 2025 that we're budgeting for.
Got a question, Mayor?
Do we have a plan for replacing the fund balance? I didn't see that in here. What's the plan if we're dipping into the fund balance by 800,000? What's the plan for replacing that fund balance and building the fund balance back up?
That's something we'll have to circle back to on.
And I can kind of speak to that because we did some preliminary discussions on it. And Mayor, good question, but there really isn't a plan to build that 800,000 back up. And the idea is that, yes, we are spending from the fund balance, but staying well above the 21% threshold that we had established as a board back several years ago. And not getting close to that 21%, but not a specific plan to add additional revenue to increase the fund balance.
Can I, that's why I made my comments about the context, was that the expectation from the previous boards, and we can change that, was to be about $1 million or $2 million above that 21, which is we're at even with this reduction. And that's why I added that for context. So, because yes, the public may look, hey, we've gone 3 years in a row. As long as that's not a continued use of reserves going forward, where we're at right now isn't appropriate. It could be higher if you wanted, the board wants to go higher than that, that's fine.
And if we used 572,000 last year and 888,000 this year, if that should actually.
That, right, so the question would be on trajectory, make sure we're not going any further, but we're,
We go further and
correct.
cross that threshold.
That's a good point, though. But I don't necessarily think it needs to be replenished. It needs to, the use of it needs to slow down.
Good morning, Board of Health members. Nikki Simmons, El Paso County Chief Financial Officer. I just wanted to get up here and give a little context to this fund balance. First, there is not a current plan to replenish the fund balance to the level that it's at currently. Best practice in government budgeting is 16.67%, or 2 months worth of your revenues or your expenditures, which is ever more volatile. And for us, we budget that 16.67% correlates to your minimum fund balance policy, which is the 18 to 21%. So you already have an aggressive fund balance policy, and then in addition to that, we keep more. And so there's a fine line between saving so much that you feel comfortable versus spending it, because you don't want to save too much tax dollars and have money that people have paid for services and we're not providing those services. So there's a fine line between saving too much and not saving enough. And so your policy is already aggressive at that 18 to 21%. I think all the people in this room probably know that I'm even more conservative than that and try to save more than that in the county's budget. But your budget, if we spend down to this balance, is still very solid, a very healthy fund balance, and above any best practice for a fund balance policy. That being said, what my recommendation would be is that ensuring ongoing in the future, past 2025, that you're not dipping into it even more. And we have made sure for this budget that we're not proposing to dip into fund balance for ongoing needs. So all the things that they're dipping into fund balance, the slide that Taylor presented earlier, are some one-time needs. The ADA accessibility project, some continued recovery programs that will cease at some point. And so we would expect that that would not continue past 2025 and that you would maintain that fund balance at a very healthy level ongoing.
I just want to be able to explain it when people ask me why we're dipping 888,000 into the fund balance.
And my answer to that, if I were the one answering it, I realize I'm not on the Board of Health, but I would answer in a way to say that we built that fund balance specifically for these reasons, to be able to continue recovery programs and one-time expenses, which is why we're proposing the use of it. I'm never a fan of dipping, well, our policies on both the county and public health side, but also just my management style, we don't dip into fund balance for ongoing expenditures.
The other side to that is that the public might also look, if we have too much in reserves or in our fund balance, they might not like that either. So that perception is reality, and they'll think we're not using our funds wisely if we have a really exorbitant amount in our fund balance. And I think it is appropriate that we use what we need since we have plenty.
I would absolutely echo those comments. That was my sort of, I think you said it better than I did, the idea that there's a way you can save too much dollars. It's not like your personal finances where the more money I have in my bank, the better. When you have collected public funds, you want to make sure that you're expending them for current services.
Go ahead, Susan.
I wanted to add to Glant's question to emphasize what Commissioner Gonzalez has said. The public health, responding to emergencies, and we have it in here as public health response and resilience. This allows us to respond quickly to anything that is a heightened concern in the public. It might not be an emergency where we are forming incident command structure and going into operations that way. However, there are different emerging diseases, and there's a lot going on with our growing population. And the fund reserve allowing us to have that will allow us to respond quickly and not have to wait on any federal funds or any other funds to start, whether it's, hiring, recruiting staff or contractors or whatever it might be related to whatever that emergency is, and even related to the fires that had happened. I mean, public health gets involved related to if the fires and there's no power for restaurants or homes, we're responsible for, facilitating and organizing things from dumpsters to get the food, or there's just a variety of different aspects that public health needs to respond quickly to the community's needs. And I think that that's a way that to explain the use, and then also the one-time aspect. So we're not proposing that it's ongoing to support salaries of staff, but it's to get us by in that year for the needs. And then also, Taylor had mentioned that we have already been successful with your support, increasing the fees that we could for cost recovery and environmental health. We're looking into legislation and with our partners as it relates to the retail food establishment inspections and the work that we're responsible for there. We're also going agency-wide, program through program, as it relates to what fees are charged, when have they been increased, and they haven't been increased for quite a while, especially given the last few years of the pandemic. So where can we do some more cost recovery? And the authority falls under my direction with a lot of those fees, and so we'll be evaluating and assessing. So there's a number of different strategies that we are going to look over to always be cognizant of how do we bring more of our balanced budget or our base budget in line with meeting our mandates and also responding appropriately within the community. So there's a lot that goes into that, and we appreciate the questions because I know it's important, and through the pandemic, that's where the fund balance really has grown to be extremely healthy, essentially like double of what the Board of Health policy states.
Yeah, a couple things that helped me, and I appreciate the question too, because that sounded awfully like my question earlier when we were discussing this, is that a portion of the fund balance draw is for, as Susan just explained, for those unforeseen needs, for the agency to be able to respond very quickly to those emergency needs that might arise. Doesn't necessarily mean they're going to arise, and if they don't arise and the money, it doesn't get expended, then it goes back into the fund balance. So it doesn't go away, but it's there so that the agency can make a rapid response when necessary, if necessary, for any emerging diseases or any emergencies that come to our community. The other thing is that so the fund balance can feed back into itself if we don't expend that money in 2025. So I think that's important for all of us to know that that money is, I'm going to use a word that nobody else has used, and it may be inappropriate, I don't know, contingency. It's being set aside as a contingency so that can be drawn upon instantly and not wait for a monthly board meeting to come around if there's an emergency in our community that needs to be responded to. However, there's going to be accountability for it, so if anything is spent, the board will be made aware of what those expenditures are on an ongoing basis. Go ahead, Commissioner Donaldson. Councilman Donaldson, not Commissioner.
They both start with a C, it's okay. If we had had that public health response and recovery amount set aside the last 5 years, would we have used it in each of those years?
Help me to understand your question, like what amount,
So
or
we're
if we would
saying
have
this
used
is a
some.
one-time expense, you know, and we may not even use it. But if looking back historically, yep, we would have used that last year for some fire response or other things, then I would suggest we go ahead and this year we can do it this way, but plan for it to be a recurring expense versus a fund balance draw. And then the final one, the retail food establishments, is it also something that, I don't quite understand that one. Can you explain it again, why this is a one-time thing? If our fees aren't recovering enough, then it seems like it's going to recur indefinitely into the future.
We'll let Kat address the,
Sure. So, Kat McGarvey, Environmental Health Division Director. The one-time expense is to bridge the gap from 2025. So under the triennial review process, those fees, we're not expected to realize any benefit from any potential increase that comes from that until 2026. We historically operate with the fees being revised in 2015. Right now, it only is a cost recovery of about 41 to 45% in our program. That's a however many year gap right now, right? So as we've realized increases in staff time, staff expenditures, costs for staff, that initial cost recovery we had in 2015 has dwindled as well. So this is just to help us get to when these fees become effective so that we have a higher percentage cost recovery at that point.
And we know for a fact that they will be increased in '26?
It's got to go through a legislative process, so what that increase is still to be determined, but right now, the state is anticipating about a 75% increase at their cost, which can translate very differently locally, but we should be in that 75 to 80% as well.
And that would make up this amount that we
Correct.
are taking out? Okay, thanks.
May I ask a question?
Dr. Vu, go ahead, and then we'll go.
Did we want to address Councilman Donaldson's second question, the first question that he asked? Or
I do, but I
Okay,
can't
later.
remember it. Can you restate the question?
I think Susan can.
Well, I think I understand. I mean, you essentially were asking, like, if we had that funding, would we have
I know.
used it?
That's right.
And my response to that is that we used to have an amount that was sectioned out specifically for emergencies. However, we didn't have that through the pandemic because we had so much opportunity for the COVID response and the grants. So if I understand you correctly, is you're proposing that we go back to that as a board too, if that's something that we need. But that's what we used to have, and yes, we never can anticipate what is going on, and I wish I had a crystal ball, whether it was for respiratory illness season or many different aspects, but that funding previously, there were years maybe where we didn't, have to use that, but we never know what the future is going to bring, and it provides a lot of confidence in our staffing related to, what can we move on quickly, and a lot of times when we see the tidal wave coming of, our response related to what we're going to have to face, there's a lot of different aspects that we'll need to move quickly on, whether it's, contracts, recruiting, and we also note that we have a responsibility. We serve as public health, we are first responders, and we serve emergency service function number 8, and that ties in with the whole Pikes Peak Office of Emergency Management, and we take that very seriously. So that is I think that is that is a need, and just to face the unpredictability, but also to maintain the resilience and the competency of staff to be able to serve as first responders in the field of public health.
How much of the 888,000, Susan, is dedicated to that? Is it?
So I'm going to ballpark figure it, and I do have line items, but I'll say about 300,000.
Okay, so
And what we've done
300,000.
is we've really went line by line to determine what the estimate would be to present the preliminary budget.
And so, like, my suggestion is if we know a portion of that 300,000 is for training, because you kind of mentioned competency and resiliency, we know that we're going to spend that. We probably will each year for training, and that should go into our non-fund, reserve fund budget versus, because then we'll always be drawing that piece out of the reserve fund. So just for this year, I think we're fine like this, but maybe for next year, or if we look back and we realize, yeah, for training we've used 75,000 each year, then that becomes part of the regular budget. So, but you've addressed it. Thank you.
We greatly appreciate that.
Okay, Dr. Vu.
Something I should remember, but I don't. I apologize. In terms of one-time expenses, is there a threshold amount where the decision needs to come to the board?
Well, that's essentially what we're doing. Yes, so we will always come before the board anytime, for the for your budget oversight to approve of our budget, but then also if there's any changes to that adopted budget, we will come back to you to receive funding or to use funding. So yes, we will always do that.
Thank you. I guess maybe I can ask you the other. Is there an amount that can be used without going through the board? Can Susan spend $200 for a one-time expense without going to the board?
So, yes, if and when you approve of the agency's budget, that is our agency's budget, and then we go by that budget. So, yes.
And maybe I can get to that a little bit clearer. I would say no. So if we approve this as it is, then that puts that roughly $300,000 in a contingency, and the agency won't have to come to us for approval to spend that, but they do have to account for that and tell us what it has been spent on, so that the board remains aware of that. If the emergency were so great that it would exceed that $300,000, then they would have to come back to us to get more money from the reserve account to meet their current needs. Okay, now I'm going to get corrected. Go ahead.
No, I just wanted to add to that, and this may not be what Dr. Vu is asking, but within the amounts that are set by the budget, there's then a separate procurement policy that dictates
when specific expenditures do need to come back before the board. I don't know what those thresholds are off the top of my head, but there is a certain amount where Susan can go out and buy office supplies and things like that without coming back to the board for approval of those purchases. But if she needed to incur a large expense, like say a couple of new vehicles or something,
Right.
then that, once you cross that threshold, then those purchases do need to come back in front of the board. Even though they may already be in the budget, the purchases still need to be approved.
Thank you, Lori. That was my
I
question.
am not aware of a policy at Public Health that there's a threshold dollar value. There is at the county. But on Public Health, I believe once we approve the budget, it's within the director's authority to spend the budget as approved.
However, we do fall in line with the county's procurement. So for example, if I'm going to go out for a contract, let's just say for a peer support program for resilience, and it exceeds a certain dollar amount, I have the responsibility not only as a good business practice, but to receive quotes and to go out for requests for proposals, RFPs. And so we do fall in line with that. But when the you all, Board of Health, approve a budget, then that's my responsibility to execute that budget. And if I'm going under or over or need additional funds, then it's my responsibility to come back to the board, whether we've achieved, new grant funding, and that's where you see the contract synopsis. So that's why we come back to the board at different points in time to accept the revenue and then also monitor for the accountability as it relates to how we are spending the agency budget.
So I guess what I'm hearing is that the threshold is the approved budget.
That would be accurate, that if the agency needed to spend money that wasn't in the approved budget, that's when they would have to come back to the board for approval to buy anything.
Right.
But if it's within the approved budget, there's not a threshold at which we bring those specific expenditures back to the board. But they are required to follow government procurement practices
Yes.
where if it's over $150,000, it has to be competitively bid. If it's over $40,000, there's a
Perfect.
request for quote process, things like that.
Thank you. Can I ask, then what is the county doing when you say there's something at the county that's
Yeah.
not in place here?
We bring any expenditure over $150,000 to our Board of County Commissioners.
Perfect, and that is not here at, okay.
That is not in place at Public Health. That being said, it's very rare that we have an expenditure
right.
that large.
Yeah.
I can't even remember the last time. It was probably buying Public Health South, which obviously involved the Board of Health. I don't think that we've had any expenditure, except with one exception, the generator.
The
for
generator.
Public Health South.
Okay,
So,
okay.
and that was a specifically grant-approved thing through the county, so.
Okay, thank you. Now it's extremely clear to me, but the next question in my mind, not right now, is would it be more protective for all parties to have that policy as the county does, right?
I think we could absolutely explore that through a separate process.
And Dr. Chan, you had your hand up earlier. Do you still have a question? Okay.
do. I would like to say that I am most comfortable with a fund balance that's well above the base threshold. But at the same time, I do support needed one-time expenditures so as not to miss opportunities. I don't think that a fund balance of, say, 30% is really necessary. And so I do support needed expenditures. My question, I have two questions. One is related to the licenses, fees, and permits. There's a significant variance for this year. And I just want to check and see if that is primarily because of shortfalls in retail food licenses, fees, and permits. Is that what accounts for this variance?
So we've done a agency-wide look at fees, not only in environmental health, but across other divisions as well, to make sure that we are providing an accurate estimate for 2025 moving forward across the agency to make sure that our budget number is a workable number that we can get to. Sorry, thought I saw somebody there.
You're good. The majority of licenses and fees comes from environmental health. There has been a significant decrease in licenses and fees being issued. Typically, that's related to higher interest rates, construction slowing, those on both OWTS or septic systems and retail food facilities, body art, childcare, those types of things. So it's typically associated with a decrease or an increase in the interest rates. The state as a whole is down anywhere from 20 to 30% as well, and we're seeing that trend in El Paso County also.
And I will also add, I mean, around the agency, I mean, we will be assessing the fees, but fees are charged in vital statistics for birth and death records, our travel clinic for immunizations, and so there's more that goes along rather than just the environmental health.
Okay. The other question I have is related to the budget expenditures and population growth. Just prior to the pandemic in 2019, El Paso County was already growing pretty quickly. And what I noticed was that there's a variance between the rate of population growth and the rate of public health expenditures. It looks like the population growth since about 2019 until now is about 8%, and the public health budgeted expenditures has grown by about 11%, and that 3% variance on a budget of $31,000 is a little bit north of $930,000 a year. So I'm trying to figure out what primarily accounts for expenditures outstripping population growth.
Well, I'm gonna just kind of reach for this, and Taylor, correct me if I'm wrong, but part of that I think is going to be tied to employee expenses. If greater than 78% of our budget is tied to personnel expenses, then I think that has to be a large factor in the increase.
I would like to mention that we've been successful in achieving program-specific grants, some targeted programs in the community, and so that's been a success here in public health. And we have had higher employee expenses due to benefits, so that has driven some expenditures that are higher. We have very strong benefit programs here at El Paso County, so we've had success in our grant programs. We have a strong development director here that's been, a winningest development director, I think, in Susan's time here in her 30 years in public health. So we've been successful in achieving some of those grant programs, which has sustained the agency in a time of population growth and been able to get us some excellent public health programs. And we've had significant expenditures in benefits. So I think that's why you're seeing some of that difference in growth there in expenditures.
I do see that in 2019, there were 158 FTEs. And so was 2019, well, prior to the pandemic, was public health significantly understaffed? And then during the pandemic, you got a little bit closer to what you needed for full staffing and then retained that staffing?
There's a lot of history there to review. So in 2018, our FTE count was 148, and the National Association of City County Health Officials report that gives averages for what health departments have that are serving 500,000 to almost 1 million is we're usually 100 less FTE than other like counties. And I did want to mention that just for perspective too, I did look into different Colorado counties as it relates to FTE counts and their budget, because I wanted to understand. I had been hearing that there have been some layoffs in some counties as it relates to public health, and then just wanted to get some perspective related to like-sized counties. So with with Arapahoe, they have 202 FTE. And then with Adams County, they have 219 FTE. And then with Jefferson County, I do understand that they recently went through a layoff of about, I think, 17 people. So I think that where we have been trying to go and stabilize as it relates to after the pandemic, I feel like we're in a really strong place. And does the staff feel stretched related to serving and the population and meeting some of the demands? Yes. I do feel like we are doing a good job, though, stabilizing as it relates to the past few years and the turnover and trying to gain support for resilience and the professional development and really building back after the pandemic to right-size the organization, but then also as we've come out of the incident command and focusing on the pandemic. So the county commissioners had approved, as well as the Board of Health, back in 2018 for 2019, we had a 5-year funding roadmap, which the Board of Health approved using fund balance paired with increased support from the Board of County Commissioners funding to hire 10 additional FTE. That's where we get to the 158 FTE. If you remember back in 2019, it was very challenging recruiting staff as it relates to just the job market. And so we had just hired, I think, our last 10th FTE at maybe the last month in 2019. That's when the pandemic started to emerge, and then we got hit very hard in 2020. With the support of the Board of County Commissioners, we had some critical needs that has really done a great service to the community, and that's part of us being able to establish a data analytics office, which we had never had before. We were able to hire a public health nurse to increase access in the county to meet people where they are, to provide the vaccinations, and that really helped us mobilize very quickly. We also were able to hire an emergency preparedness coordinator specifically for El Paso County, because we served a region of Colorado, and that really stretched us, as well as there was some support functions in there, an epidemiologist. So those 10 FTEs were crucial to the support of our agency. And then through the public health infrastructure grant, which in my time here, we have never had a significant grant like that. That's nearly $8 million and goes through 2027. That has really been helping us with our infrastructure. And so we are making progress in building. And I always say that we're not trying to get to the 309 FTE count. We are focused on what is it that we need? How do we meet the community's needs, the county's needs, to respond quickly and appropriately as it relates to the population growth. And with our staffing, also wanted to provide a refresher, and you all probably already remember, but we are the first accredited health department. We are the second re-accredited health department in the state of Colorado. We meet rigorous standards, so our agency functions very well. Over the last, I believe, 7 years, we have clean audits. So this department accomplishes a lot, and that really goes to all of the employees and the teamwork that occurs. Do we need to continually increase the staffing as it relates to some of the needs? For example, what you had brought up related to men's health issues, those kinds of things. And then where could we be strategic? Is there grant funding for the needs? Or if there's not, then we'll come back before the Board of Health and see where we can start up. In the future, what we do plan to do is build out to increase more services in the southeastern portion of the county with the public health building. But we have already been able to successfully increase access to services through the support that you all provide. We are in every part of El Paso County with our women's, infant, and children, whether it's Calhan Fairgrounds, all the way down to Fort Carson. And so we've been talking about, like, how do we increase our services strategically, and that's what we have been doing. So when you compare us to other counties in the state of Colorado, we do have less FTE, and we are below the average national FTE. We accomplish a lot with what we're given, so I'm always asking, with the county commissioners and funding sources to maintain what we have, and then continually trying to determine where can we gain some more support for cost recovery, or at the state legislature to try to continue maintaining our staff, but then also increasing the strategically. So hopefully that answers your question and maybe a little bit more, but there's a lot of history there, and throughout the year, grants come, go, FTEs decrease, increase, and so even the count that you're seeing with 2 less from 2020, 24, for 2025, there's a lot to, there's a lot more detail than what is being seen in just the numbers.
Are you feeling comfortable with your staffing level, or are you projecting an additional need to increase the number of FTEs in the next few years?
Well, I will say I don't have a steady state of comfort within the arena of local public health. What I continually focus on as a priority as the director is how do we maintain funding, how do we increase funding as it relates to what are the needs specifically around the data, and that's where I continually focus. And so I don't think I'm ever comfortable with the state. It's always about here's where we are and acknowledging the good work that is happening, but always looking towards the future related to how do we build strategically, and it takes time to do that. And so over the next year, we are planning to even look more strategically around our base budget and how to come more in alignment, but it's a constant process because 24/7 there are things that are happening in the community, and I know the great work that our folks are doing, and they work 24/7 on aspects of health protection that is not in the media, nor does it need to be in the meeting, but folks are working hard. But I'm consistently trying to work to build and strengthen local public health for El Paso County.
Thank you.
And real quickly to your second question, Dr. Chen, when we look at expenditures from 2019 to present day, we have a lot of COVID expenditures through 2020, and 2021, and 2022. The majority of those COVID, the increase in revenue were from reimbursable grants, and with those reimbursable grant revenue comes reimbursable, you have to expend the money to bring that revenue in. So there is an increase in expenditures through those COVID years that would be driving that variance you're seeing between population growth and expenditure growth over those years. So there are some extenuating circumstances and outside factors that do lead into that increase in expenditures, mainly COVID grant funding that we did have an increase in expenditures that is not, always common. So that is a portion of what could lead into the variance you're seeing. Okay, last financial slide here, just total expenditures. As we've talked about, personnel is about 78% of the total budget this year. We do not have any planned capital expenditures at this time, and operating is around 22% of the 2025 budget. And lastly, this slide you're seeing here, numerous recognitions for public health, transparent budget reporting. These come from the budget documents that are compiled by not only the budget team, public health staff. None of this would be possible without all of public health staff continuing to do great work and continuing to do things the right way. Susan mentioned that we have had at least 7 years of clean audits going back, which is a great accomplishment. And none of this would be possible again without all of public health staff. And I just want to say thank you again to them as we've gone through the the budget process. And I want to thank them for all of their hard work and time, and thank you guys as well for the board for their continued support.
Thank you. Any further questions for Taylor? And if not, I will need a motion to accept this preliminary budget as presented, and then a second.
Doris Ralston, so moved.
Okay, thank you, Doris. Do we have a second?
Second.
Commissioner Bremer, thank you very much. And
So I would, in terms of discussion, I would wanted to clarify that the budget includes clinical revenue as part of the line item in the licenses, fees, and permits in both 2024 and 2025.
Yes, clinical fees would be a part of licenses, fees, and permits. It falls in that line item.
Thank you.
okay,
As far as I'm aware, this is actually agendized as a non-action item. This is just basically Director Whelan or the agency's proposal to you for what the budget should be. And then through the next month, so back, I think in December, is when you'll actually take action to accept the budget. And so
Got it.
between now and then is when the board can make their changes if they wish to do so. So my recommendation is to not take action today.
no vote.
No vote, as you don't have to accept this budget if you, for lack of better words, if you really disagreed with it, it is fully within this board's purview to change it to whatever they need to change it to. So I would recommend no action today.
I rescind my motion.
Second.
So rescinded.
Ms.
Go ahead.
I was going to say, we still, because this was presented and it was a public, for the public, still offer if there's anybody in the public who'd like to comment today.
Sure. And do we have any public comment? Anybody weighing in? Nothing online. Okay. All right, Commissioner Bremer.
Thank you. Commissioner Gonzalez and I were on the same wavelength there. We've been doing just a few of these. But I also just wanted to commend Susan and your staff. I know how much work this takes behind the scenes. And Sarah and Nikki, everybody on the finance team who has helped ensure that this last slide we're still looking at here, with all the awards and recognitions, I fully expect that in 2024, in 2025, that 2024 will be listed on here as an exceptional budget award as well. You know, I think that as we sit here as board members, we oftentimes we get into the weeds on health issues and the things that are important to the health and well-being of our community, and it's really, I think, a difficult and monumental task to incorporate all of the strategic direction and great suggestions that come out of this policy-making board into something that's operational and actionable in a budget. And so that takes a tremendous amount of work, a tremendous amount of paying attention to the priorities of the community and the direction of this board. And I see it reflected in what looks like, you know, the final slide with a very kind of simple and smaller categories of budgets, but knowing that that's all funneling up from an entire operational plan, departmental budgets that actually help the work happen. So huge kudos, and I'm sure that anytime anybody wanted to see all of that detail, it's all also public, and I just think it's a monumental task, especially with this diverse and strong expertise and opinions around the table on this board to come to something that operationally is what's best for our community. So thank you.
Well said, Commissioner Bremer. I think the other thing that I was going to point out is that Commissioner Bremer, Dr. Vu, and myself have had the opportunity over the last couple of years. We've gone to the NALBA conference with Susan, and that's the National Association of Local Boards of Health. And to your question, Dr. Chan, we do have a small staff. There's no question about that. But the amount of work that is being done and the quality of work that is being done by this organization cannot be overlooked or overstated. And when we're at those national conferences, to see organizations that have much bigger staffs, more robust funding, and they come to Susan to ask how do you do it? How do you accomplish all that you're doing? It's really, it is very satisfying for us as members of the board to see that and to know that this staff, it's not Susan, not just the executive team, although they're all a part of it, but it is down to the most junior employee that just got hired, knowing their job and working for the health and welfare of our community. And so in relation to the 309 national average, and we're sitting at 195, I would say, you know, we always want that number to grow, but growing based on the needs and the services that our community requires. If there's something out there that needs to be done to serve the community of El Paso County that's not currently being done, that's where we need to take action. We need to make sure that we are able to add the staff necessary to meet the needs of our county. But I would encourage other board members, when those opportunities come around from year to year, to attend some of these conferences, whether they're state conferences or national. If you are able to attend, please try to, because you will be pleasantly surprised by the comments, the accolades, and the just the attention that this organization draws from a larger audience because of the work that they're able to do. So again, I will go along with Commissioner Bremer and say thank you to all of the staff. We see what you're doing. We appreciate all that you're doing. And as citizens of El Paso County ourselves, we're very grateful. Any more discussion? No, thank you, Taylor. Appreciate the presentation. And now let's move on to the director's report.
Great. So I am going to ask Michelle Byerly to come up, and she has been promoted to our agency's new division, which is strategy, data, and communication. And before I have you say a few words, I did want to state that we have eliminated 4 positions in order to collapse and convert to get to a fully staffed executive team. And the fully staffed executive team is at 5.5 FTE. And that has been some work over the last couple of years where we have had different roles within the agency. And so now we have a fully staffed, and I'm very excited about that with the hiring of Kat McGarvey for our Environmental Health Division Director recently, as well as Michelle Byerly being promoted. But what we did was we collapsed the, when a strategic initiative officer had left, we did not refill that position. And then it's been about at least a couple of years where we weren't able to hire a chief scientific data strategist, if you all remember Stephen Goodwin, for the data office, and then the Office of Communications. So really this is combining 3 in 1. And Michelle had applied for the job and was unanimously selected to serve in that role. So I did want to make mention and give you all the opportunity to know that she will be leading the efforts of the public health accreditation. We'll need to get reaccredited, so that will be going on. But the community health improvement plan, the community health assessment, all of the reporting, the data analytics office, the Office of Communication, and very different strategic initiatives. And so Michelle will be overseeing all of that. So congratulations, and I just wanted to introduce you to the board with your new title.
Thank you, Director Whelan, for those kind remarks. Good morning, Board of Health. It is an honor to step into this role. I've been with the agency just about 7.5 years, and I've had the opportunity to work with many of you over the past 4.5 years in my role as Public Information Officer. As I step into this role and we build our new division, the 3 teams that Susan had mentioned are absolute powerhouses. Our data and analytics, communications, and strategic initiative staff are phenomenal. They are exceptionally talented, and I am amazed and humbled by the work they do each and every day. So I think there's a lot of excitement about what we can do together with these 3 programs to positively impact our agency and our community, and it is truly an honor, and I'm humbled to be able to lead and support those teams. So thank you.
Welcome.
And I do not have anything else because I had anticipated that we'd have a good number of questions for the budget. And I don't think that anyone will be sad that our meeting will be ending before the 10:30. And I'll take any questions if you have anything in addition to the budget.
Go ahead.
Susan, I think that was a brilliant usage of open positions and difficult to recruit and unfilled positions. All of those things you mentioned that are now under one office, they rely on a great deal of external communication with the entire public and working with other entities, and then the ability to communicate the information you receive back out. So to have a communications professional in that, honestly, I might be a little bit biased, but I think that's pretty brilliant, and I look forward to the community realizing what happens with all of those reporting mechanisms and actually having it go back out and be a back and forth relationship with the community by having the right person in the right place. Good luck. It's a big one.
Any other comments from the board?
Any information on E. coli cases in El Paso County? Any update on that?
Or like with McDonald's, huh?
Well, yeah, I mean, that's where it's coming from evidently, but in this county specifically.
I would ask Haley Zachary to come up or Deanne Ryberg.
Hi, is this on?
Flip it up.
Make it in the up position, the little switch.
Negative.
There you go.
I've got other talents. So we are seeing an increase in E. coli cases, not necessarily associated with the STEC outbreak, although Colorado is having cases related to that. So we are currently investigating those to look at the commonalities among those cases and then working through those with the state to ensure that people have the right access to care, testing, as well as recommendations for treatment with their providers. Dr. Albanese, do you have anything to add?
Hi, I'm still good morning. It's all right, that's why we love working together. Good morning, Bernadette Albanese, co-medical director. Yeah, this is only the beginning. This is going to be a big outbreak. So right now there's 49 cases. So what happens is people get sick, they eat something not good, they get sick. Some people not that sick, even with E. coli infection, and get better. And then a pretty good proportion get sick enough that they may seek health care. And hopefully the provider makes a decision because of the severity of symptoms. It could be blood in the stool, which is, we've all had some GI distress here and there, but when you have more severe symptoms, blood in the stool and so forth, really severe abdominal symptoms, hopefully they get a test, and then that test gets reported to public health. So that's the beginning of recognizing it. All of these, once the organism is identified as one of the bad E. coli organisms, that comes to public health, and we do the investigation, and all of that information rolls up, and then eventually some bells go off, like this is happening really close together. There's been, since the end of September, a whole bunch of cases that would normally be spread out around the year, right? Or maybe during the summer months a little bit, right? But so they're tight. We do interview people about what they ate a week or so before their illness, and we start ringing a bell if it's the same restaurant. This is the routine stuff that all of our communicable disease team does. We do this very well in El Paso County. And then things get put together. And then the last big piece of this is the laboratories send specimens to public health, and then we then get to fingerprint it. And so what happened was we started getting these clues of there's way too much E. coli infections going on right now. And oh my goodness, a bunch of them are eating at McDonald's. And oh my goodness, they're eating quarter-pounder burgers. And then the lab came in and said, these are fingerprinting identical. So that's where we landed with the press release yesterday from the State Health Department. There's a posting now on CDC's website. Susan will be happy to, Haley and I can share those links. And now this will be ongoing. So this is a very active investigation. 10 states involved, 49 cases. We are not done yet. As people, continue. Now, the USDA and the FDA are involved because when you get a national outbreak like this, even when we were getting involved in Colorado, they're like, this is not right. There's a problem with a piece of food somewhere. And so they're doing their investigations. They look at ingredients and so on and so forth. So because it's quarter pounders apparently are a little different in terms of how they're prepared compared to other McDonald's products. They're looking at beef and then looking at vegetable ingredients, particularly the onions. And so now we're going to try to test food, try to see if we can find, you know what I mean? All this puzzle is getting built out. If you saw in the press release and in the news, on the CDC's website, McDonald's has if you look at the map right now, the way that it stands, it's sort of central to upper west in our region. So you can kind of think about food distribution. You're like, is there something going to these states? And so, McDonald's has, and I'm just reporting this from the news and from CDC's website, that they are making changes in terms of not distributing quarter pounders for a while, not using the onions for a while until this can get sorted out, right? This is how the dots get connected. What it starts, unfortunately, people get sick, which is not what we want, but then this is how the dots get connected in public health. And then when you have a state right now disproportionately be impacted in Colorado, though again, that's we'll see where that goes. We take the lead on the outbreaks, and I say we, from a public health perspective, and the State Health Department takes the lead with CDC, and we try to get things moving quickly. And so this is how it works, and we just happen to be in the center of it at the moment. But there will be more before this is finished.
Specifically, I think 26 cases out of the 49 are in Colorado. There's been one elderly person who died. But have there been any cases in El Paso County?
That match?
There have been 2 cases that have been identified as matching. That doesn't necessarily mean their exposure was here, but they do reside here.
Okay, thank you.
Yeah, that's a great point. The cases are assigned to where they live, and then they try to figure out where they've where they might have been exposed to the implicated food. And for something like going to large food chains, just think like, oh, beef and onions. Right, so there may be other implicated product as this grows and we get more laboratory data in, and the FDA and the USDA does their piece in terms of looking back to where product began and testing product and trying to figure out what might have been contaminated and how.
Are there any, in 30 seconds to a minute, any symptoms you'd want to tell the public, hey, if this is happening, go ahead and go in and get checked out? High fever, blood in the stool.
Yeah, so if you have, and now that we have an association with McDonald's, if you've had McDonald's, particularly a quarter pounder, and within about a week to 10 days you develop severe abdominal pain, diarrhea, potentially bloody diarrhea, fever, then those are reasons to contact your provider and saying, I did this and this, and I have some symptoms, and I see that this E. coli is a problem. I'd like to be tested. And it's a stool test.
Thank you.
Any other comments from the board? If not, I think Susan has something she was going to bring
I
up.
wanted to note that typically every year at your December meeting, which is December 11th, we have a holiday luncheon that I would like you all to attend if you're available, but I did want to note that we can flag you to that on your calendars, but that will be December 11th, right after the Board of Health, and we usually have some fun with like some ugly Christmas sweaters also.
Will you be serving quarter pounders?
Okay, all, thank you very much for everybody for your great questions as the budget was presented. And now I will look for a motion to adjourn.
Move to adjourn.
Thank you, Commissioner Gonzalez. Do we have a second? And thank you, Mayor Havener. All in favor, say aye.
Aye.
Thank you. We will see you next month. You're welcome. I didn't miss anything. You didn't have to nudge me once.